Washington Journal is next.
This is the Washington Journal for April 6. Former President Barack Obama was back at the White House Tuesday, not only to tout one of his key legislative achievements, the Affordable Care Act, but also support President Biden's effort to strengthen the health care law. Millions are now receiving health care support from it. There are concerns from some about its sustainability, especially when it comes to federal subsidies given to some recipients. And over the next hour, we want to get your assessment of the Affordable Care Act at its 12th anniversary. Perhaps you receive it yourself and you want to tell us about your experience. Perhaps you've been impacted by another factor of it. Now's your chance to call us and let us know. Republicans 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8002. If you wish to text us, you can do that at 202-748-8003. Post on our Facebook and Twitter feeds, and you can also follow the show on Instagram. It is an event you can still see at our website at cspan.org and C-SPAN Now. President Obama, former President Obama, hugging the picture in the Associated Press provided to the Washington Times, hugging his former vice president, now current president Joe Biden. And the talk was about the Affordable Care Act at its 12th anniversary. In a bit, we'll tell you how President Biden hopes to strengthen that. But it was President Obama that not only talked about the passage of the act, but its impact.
You know, as a country, we have been talking about reforming health care for 100 years. Unlike almost every other advanced economy on earth, we didn't have a system that guaranteed access to health care for all of its citizens. Millions of people didn't have health insurance, often because their employers didn't provide it or because it was too expensive. But despite the fact that our healthcare system didn't work well, it was hard to change. Healthcare represents about 1/5 of our economy. That's trillions of dollars that are involved. So there were a lot of different economic interests that were vying to maintain the status quo. And because the majority of Americans did have health care, some people naturally worried that they'd lose what they had. The media was skeptical of past failures. There was a lot of misinformation, to say the least, flying around. And it's fair to say that most Republicans showed little interest in working with us to get anything done. That's fair to say. But despite great odds, Joe and I were determined. Because we'd met too many people on the campaign trail who'd shared their stories. And our own families had been touched by illness. And as I said to our dear friend Harry Reid, who is missed, wished he was here today, because he took great pride in what we did. I intended to get health care passed, even if it cost me re-election, which for a while looked like it might. But for all of us, for Joe, for Harry, for Nancy Pelosi, for others, the ACA was an example of why you run for office in the first place, why all of you sign up for doing jobs that pay you less than you could make someplace else, why you're away from home sometimes and you miss some soccer practices or some dance recitals. Because we're not supposed to do this just to occupy a seat or to hang on to power. But we're supposed to do this because it's making a difference in the lives of the people who sent us here.
When it comes to those enrolled, back in 2014, when enrollment started under the marketplaces, 8 million people taking advantage of that number growing in 2022 to 14.5 million. Other people getting Affordable Care Act assistance from Medicaid expansion. When it comes to the piece where President Biden is trying to fix the so-called family glitch, it's the Washington Times that picks up what he's trying to do, saying that the Treasury Department is issuing a proposed rule to help family members who are shut out of the ACA's insurance exchanges if a spouse or parent is offered coverage by an employer. An individual can access exchanges and subsidies that defray premiums if the cost of employer-based coverage exceeds about 10% of their income, but that provision doesn't come into account to cost to cover dependents. The new rule will apply that affordability standard to the whole family instead of the employee alone. Therefore, spouses or children who lift the cost of premium contributions above 10% of income can seek subsidized insurance under Obamacare. Again, that's just some of what took place at the White House when it comes to the Affordable Care Act. For the next hour, your experiences with it, whether you received it directly, perhaps impacted in other ways by it. And here's how you can call us and let us know. 202-748-8001 for Republicans, 202-748-8000 for Democrats, and Independents, 202-748-8002. You can text us thoughts at 202-748-8003. This is Devon in Capitol Heights, Maryland. Independent line starting us off. Good morning. Go ahead. Devon in Maryland. Hello.
Yes, sir. Can you hear me?
Yes, you're on. Go ahead.
All right. Just wanted to give a quick compliment first. Thank you for having me on C-SPAN. I listen to you all every morning on the way to work. Just wanted to say I listened to the whole event this morning on the way to my son's childcare, and I thought the event was beautiful. I wanted to thank President Barack Obama and thank President Biden for all their hard work on the ACA. And that was it. Just a quick compliment on that.
Well, what do you think it's accomplished over the years that people have signed up for it?
I didn't know the vast amount of American citizens that were signed up under the ACA. I didn't know that it was I didn't know that it was that many people. I've been hearing about it a lot. I just didn't know the exact numbers. And then hearing that Biden's gonna fix that family glitch, and that's gonna provide even more coverage to more people, and then help cover the entire family. I think that's an amazing thing. It's gonna help out a lot of families.
For yourself, do you receive, if you want to answer, do you receive insurance from the ACA, or do you get it from your employer, or how does that work?
Yeah, I get it from my employer.
And do you think any changes happen because of your employer insurance because of the ACA?
I don't think so. Does the ACA affect employer insurance as well?
It's separate from that. It's just some people say that employer insurance plans were affected in some parts of it. I want to see if you saw any significant impact from that.
I didn't. I don't think so. I can do some research and find out, though.
Okay. That's Devon there in Capitol Heights, Maryland. One of the people responding from the Competitive Enterprise Institute at the anniversary of the Affordable Care Act writes this. This is Joel Zindberg saying that health insurance coverage gains are well below the $25 million predicted by the Congressional Budget Office just prior to the statute going into effect. Nearly all the net coverage gains have come from increased Medicaid coverage, which offers inferior insurance with limited access and long wait times compared to other health insurance. The ACA's Medicaid expansions led to a tripling of the national improper payment rate for Medicaid, which, according to the Center for Medicare and Medicaid Services data, now stands at 22%. Now, most of the improper payments are due to eligibility areas, according to Joel Zinsberg, saying that the ACA's best-known feature, the health care marketplaces, or the exchanges, have not been terribly successful. Marketplace enrollment was offset by a decline in employer coverage. Premiums and deductibles for marketplace plans have soared, a fact that is hidden by the fact that nearly all the enrollees are heavily subsidized by the federal government. Again, that's from the Competitive Enterprise Institute. Bloomberg Law has a piece out as of today taking a look at those subsidies. And here's what they in part write, saying the future successes of the Affordable Care Act depends on Congress taking action to continue increased subsidies to people on individual plans. According to People on Tuesday, quote, we call on Congress to make permanent the ACA subsidies that are included in the American Rescue Plan, subsidies that are currently lowering insurance premiums for millions of Americans and were set to expire in December. That was the Vice President, Kamala Harris, saying that at the White House Tuesday. This story adding that those additional subsidies provide extra help to people at all income levels and went to households earning more than 400% of the federal poverty level for the first time. This adding, without the American Rescue Plan, healthcare subsidies aren't where we want them to be, which means that some working families are still having trouble paying for their coverage. That was President Obama from yesterday. Let's hear from Robert in Washington, D.C., your view of the Affordable Care Act, this out of a White House event yesterday. Robert, on our independent line, good morning. Go ahead.
Yeah, good morning. Thank you for letting me call in. Well, I had Medicaid right before the Obamacare came in, and as soon as I did get it, then they ended up kicking me to the curb, and I didn't figure out why when the program already was working quite fine, and I never had a problem all the way up until the program actually kicked in. So to me, I thought it was a disaster. And then they started off with, I think they called it universal health care. Then it changed to Affordable Health Care Act, then Affordable Health Care, and then Obamacare. Well, the real health care, please stand up.
What's your health insurance situation like now?
Well, I don't have any. That's the problem. Whereas everything was fine. I had Medicaid. I was going for my Social Security disability. I was having some health issues at the time, and everything was working fine. There was not even a single problem, even before they even talked about a health care program. Now, I'm here in D.C., so we have excellent health care here, but the thing is, it's so much red tape that is involved in, filling out papers, this, that, the other. And so it just became this mind-boggling, just even continue on with that program. So I just had to go with either some type of alternative care other than that what was, standard issue.
Okay. That's Robert there in D.C. Let's hear from Angela in Missouri, Democrats line. Hi.
Hi there. Good morning. I think that the Affordable Care Act is necessary. It is a good act. It should be increased. I believe that everybody has a right to health care. When I worked, I had health care coverage under my job, but I retired. Now I don't. I have to go through Medicare. I think that something needs to be done about the Medicare system. It's horrible for senior citizens who have limited income. However, I think that what we've done with the ACA is wonderful, and I think it should be increased. And I, as a citizen, am willing to pay what I need to pay fairly to help everybody get health care, because what affects one person that doesn't have health care affects me eventually. And I don't get what people don't understand about that.
In Gulf Breeze, Florida, this is Dave on our independent line talking about the Affordable Care Act. That event at the White House, by the way, still available at our website and our C-SPAN Now app. Dave, go ahead.
When the Affordable Care Act first came out, I thought they were going to lower the cost of medical care. Really, the Affordable Care Act is just about insurance. For example, my wife, she had to have an operation on her shoulder, and when we got the bill, it was $66,000. Well, my wife qualifies for Medicare, and so the bill went from $66,000 down to under $5,000 when Medicare paid that, and then we paid a supplement on that. The Affordable Care Act, though, really just covers insurance. It doesn't really cover affordable care, and I'm thinking that because of the price difference in what they would charge me and what they're charging the insurance companies, I could afford the $5,000 or less than $5,000 because it only happens. It happened once in 10 years. I could save enough money to be able to afford that. But $66,000 would have definitely hurt. And so when the Affordable Care first came out, too, I went online there, and because of our age, I was making $44,000 a year, and the payments for the Affordable Care, because we didn't qualify for subsidies at $44,000, was $1,700 a month. And so that would take a really big bite out of our living income with house payments and all the other payments that we have. So I'm not sure that the Affordable Care Act is what I thought it was going to be. It's really about insurance, and it's not about affordable care.
Okay.
And it's just the name on there.
That's Dave there in Florida. We'll hear next from another Dave, David in Flint, Michigan, Democrats line. Good morning.
Good morning. How are you today? I'm happy for the Affordable Care program that Obama came up with. I think it's just been a godsend for our country, for the poor. I've always worked, and I've been retired 16 years, but not really retired because I'm still working. So I've always had my insurance, but I always worried about the people that couldn't afford it. Luckily, I live in a county in Michigan, Genesee County, where they used the Affordable Care Act, and I live in Flint, Michigan. Well, what's good, our county voted to let everybody have, all the indigents, all the poor have health care. So nobody in my county that really wants dental or health has to go without. And I think it's a blessing. All America should be like Genesee County, Michigan.
Okay. We'll go from David in Flint, Michigan. We'll go to Steve in Charleston, South Carolina, Republican line.
Good morning, Pedro. The biggest failure of the Affordable Care Act, Pedro, is just obvious. It's the astronomical deductibles and copays. And if you go to one of the higher graded plans, the expense of the plan, the premiums are just astronomical. But and by the way, before callers start calling in and say, hey, I want the same kind of health care that congressmen and senators have, let me tell you, one of the provisions of the plan in 2010, and I know this because I talked to Lindsey Graham and one of the staff members, says one of the provisions that all Congress and staff had to take an Obamacare plan unless they had maybe a spouse that had a federal employees health benefit plan, or maybe they were military retirees that had TRICARE for life. But the biggest problem with health care these days, Pedro, and I know this because my mother passed away in 2014, and I saw this happening, and now it's happening today. And if you're in the healthcare profession, call in and tell me I'm lying. If you're a caseworker, when you go in the hospital now, a caseworker is assigned you, and their job is to get you out of that hospital as quickly as you can. I have two brothers-in-law in the last year that had major surgery. And I mean, they pay thousands for health insurance. I pay thousands. I have Medicare and Blue Cross Blue Shield. They kick you out of the hospital now for knee replacement. They won't even give you one night. There's always a danger of bleeding, hemorrhaging, or blood clots. Now they kick you out of the hospital the same day. It's not the doctors. They would love to keep you in there. I've been told this by a doctor, my mother's doctor. He said, hey, I can keep her in there, but you're going to have to pay for it. I'm going to have to pay for it out of pocket. Medicare bureaucrats are determining your health care, not doctors, and that's a major problem in this country, considering how much we pay for health care.
Okay, Stephen, Charleston, South Carolina. So we're about 15 minutes in on your thoughts on the Affordable Care Act. Perhaps you yourself receive it, other people talking and giving other anecdotes. Again, we'll continue on until 8 o'clock, 202-748-8001 for Republicans, 202-748-8000 for Democrats, and Independents, 202-748-8002. One of the people responding on the networks yesterday, a Republican Congressman Ted Budd, on that ACA anniversary, he said these remarks on Newsmax TV. Here's some of his remarks.
I don't know if I would use the word celebrate, maybe mourning. Just our office gets inundated with calls saying they can't afford. These are people making $40,000, $50,000 a year, and the lion's share of their income is consumed by what Obamacare has essentially created. And now it looks like Biden is bringing in Obama to distract from the dismal failure that Obamacare is. This is things like, if you like your plan, you get to keep your plan. And we realize that was now the PolitiFact 2013 lie of the year. The counties in North Carolina are limited to maybe one or two plans. So it's really hurt the consumers and limited their choice.
Yeah, some of those lies regarding Obamacare make the lies about the pandemic, I don't know, look bigger or smaller, depends who you're talking to, because, I think what we saw with the pandemic management, that kind of top-down, one-size-fits-all approach, I think that was kind of emblematic of what started under Obamacare. The federal government knows best. It doesn't matter what the individual data says where you live. It might be much different than a big city if you live in a rural area. But I think, that kind of top-down, one-size-fits-all solution was applied to the pandemic, and we know that's not really the best way to take care of people.
Was like those 9 scariest words. I'm from the government and I'm here to help. Government doesn't know best. So we need more market choice, more transparency, let consumers decide what they need, what fits their particular case, what fits their family. But under Obamacare, we saw that premiums rose, millions of Americans had their plans canceled, and choices went down, and that's never good for the American consumer or for those who are truly in need of health care.
One viewer texting us saying ACA, when it comes to the ACA, employer insurance costs haven't come down. Best part of the act was the elimination of pre-existing conditions. Health insurance companies on their own are too aggressive in not paying for some claims, costs for people on ACA need to come down. Will only happen if younger people get insurance coverage. This is Chris in Wisconsin. ACA is better than nothing, but really need universal health care. The pandemic proved this even more. Health care.
All right. I don't want that header there. Well, it's Shake and Bacon. Today is April 6th. April 6th, 2022. Good morning, everyone. Have you ever had one of those mornings where you just can't really get your head in the game? Because that's definitely what's happening to me today. I had a pretty long day yesterday, though, so I'm not going to blame myself for it. I'm just going to try and get through the day as consistently as I can. So I started my day off with a little bit of cleaning. That's what I did to try and get through a quick 10 minutes or something like that. Just get a little bit of cleaning done. I'm feeling a little sick today, but we're going to kind of push through because I have a quiz, so I have to go to class. Anyway, good topics today. Affordable Care Act. A lot of people have had some things to say about it. I don't have a whole lot of opinions on the Affordable Care Act because I don't personally get affected by it.
Should be a right. Kaiser Health News.
So I'm just going to leave it up to them.
Another aspect of ACA and subsidies. They write this morning, you can find this at the khn.org, saying when federal COVID-19 public health emergency ends, as it's currently scheduled to on April 15th, though it's likely to be extended, so will many of its associated insurance protections. That includes a rule forbidding states to kick anyone off Medicaid while COVID-19 raged, which came along with a 6.2 percentage point boost in federal Medicaid funding to keep most of those vulnerable patients insured. Before the pandemic, states would regularly review people's eligibility for Medicaid benefits and remove people who no longer qualified. But with that practice suspended, Medicaid enrollment has grown by more than 12 million since the beginning of the pandemic. As many as 1 in 4 Americans are now insured by the program. Let's hear from Bradley in Marietta, Georgia, Democrats line.
Yes, I want to tell a story. 5 years ago, I was unemployed. I'd just gotten a divorce, and I went and played some basketball with some neighborhood kids, and I tore my ACL and the meniscus, everything. I destroyed my knee. So I found out about Obamacare, and if you're poor, it's actually pretty darn good. It has a large deductible, but when I met that deductible throughout the surgery, at that time I had acquired a pretty nasty little drug habit. And then I was able to go from Obamacare, because I'd met my deductible, I was able to go to a rehab. And because of there's some stipulation, it's not just the pre-existing conditions, it's also there's no limit on the amount, or they can't limit the amount that you're there for being treated. And I was able to go to California, get 4 months of actually clean sobriety, and come back here to Georgia, and honestly, Obamacare saved my life. Having said that, it's complete garbage if you have a job. If you're making that $40,000 to $50,000 they're talking about, you get hammered. The deductibles are just astronomical. It's absolutely ridiculous. And really, it's the Republicans and some Democrats. They want us squabbling over these scraps of health care while the rest of the world gets universal health care paid for. We cannot compete with Europe, China, any other country, because they all have health care provided for them.
Okay.
It's a national security. Okay. It's a national security issue. Our populations are fat and out of shape.
That's Bradley in Georgia. Let's hear from John in Pennsylvania, Republican line.
Hey, good morning. I worked for the second largest pharmaceutical company in the world, and we had what was called the Cadillac healthcare plans when this Obamacare came out. My company was hit with $15 million. They had to pay $5 million for 3 years. And what did that do? Our rates went up, our deductibles went up, our plan kind of changed. And instead of them trying to fix the 12 million people at that time that didn't have health care, they mixed everybody else in with it. My plan went down, and I think it was kind of a bad idea. I know it helps some people. People do need health care, but for somebody like me that had one of those great plans. It got worse because of Obamacare.
What were you eventually paying on that plan?
Well, the thing of it was, for a family of four, I was paying $90 a month for 30 years. And then the last years of my career there, they went up over, I don't know, like maybe 20%. Our deductibles went up. We didn't have any, and then they went up to like $400 or $600. Our plans, instead of a $20 copay, went up higher, and it just all changed because of what the company had to pay and how their costs kept going up because of this. So I wish they would have just looked at something for the 12 million people that didn't have health care and helped them instead of changing everybody's plan.
Let's hear from Ronnie Jean in Fair Oaks, California, Democrats line.
Hi. Yes, I think Medicare for All is about the best and most efficient and moral way to provide Medicare or medical care for our citizens. I just think a lot of people are not aware of the efficiency of it. When different companies have to spend a lot of money advertising and competing, it doesn't help medical care itself. It helps the people who are investing in it and making money off of it. It's become immoral.
But aside from that, what do you think about the Affordable Care Act as you understand it, as far as how well it's working or not, or what opinion you have?
I think it's done better. I do think it's better because of the existing conditions, eliminating that. But it isn't good enough. It still is like, if people want to have their own health insurance, they can get it on the side. They don't have to have it as long as they have some health insurance. But I think he eliminated a lot of fly-by-night companies that would just rip people off.
Do you think
a really good thing about it?
Do you think we'll ever achieve some type of Medicare for All system like you talked about?
Oh, I think we will eventually, if we want to be a decent country, because the people have to have medical care in order to really be functioning, and as much as we need them to be healthy and not pull the whole country down because of our medical care being so crazy. I worked in the medical field for a long time and taught medical billing and coding, and that has really drained off a tremendous amount of money when it went to that.
Let's hear from James in Kentucky, Independent line.
Yes. Hello?
Hello, you're on.
Okay. I was calling. I think that I was hoping that they would get the public option when Obama was trying to get Obamacare, and the Republicans fought him every inch of the way. And I agree with the Democrats that I'd like to see a universal health care, and I also think that we need dental and we need eye. See, I'm on Medicare now, but I also have a plan with with my pension, and so does my wife. But that Obamacare has helped because I got a brother that needs it, and it has helped us. But it could have been a lot better if Republicans hadn't watered it down. And the one people calling in and complaining about it, it's the things that they did to it because they want to keep the insurance companies in charge of it, and they get a large overhead administrative cost. And if you go to a universal plan like other countries have, you have a low administrative cost and you get more for your money.
Let me ask you this then. You don't have to share very great details about it, but your brother's experience, how would you describe that generally as far as his health care is concerned under ACA?
Well, see, he couldn't get anything, and he didn't have enough money to get anything. And now it did hurt. I had another brother and his wife, and they didn't like it because because the part where they had to pay, but they made more money. They didn't like it, but he liked it because he didn't have he worked like as a carpenter and part time and stuff, and he didn't have any insurance at all, and he didn't make a whole lot of money either. And most of the care he had to scrounge around and try to find free care, and or something like, or real cheap care. But anyway,
yeah. Okay. James, thanks for sharing that. You see the numbers on the screen there, 202-748-8001 for Republicans, 202-748-8000 for Democrats, Independents, 202-748-8002. And you can text us too at 202-748-8003. Your view of the Affordable Care Act. Again, it was at the White House yesterday. Former President Obama back with President Biden talking about the plan, talking about its achievements, and also President Biden talking about what he wanted to do to fix this so-called family glitch when it comes to the ACA. Here's a portion of that from yesterday.
And separately, it's time to fix what we refer to as the family glitch. Now, the family glitch, everybody in this room probably knows what it is. But it's a common issue facing 5 million Americans who can't get financial help to get coverage under the Affordable Care Act. And here's the problem. Under the current rules, a working mom is told as long as she can afford employer-based coverage for herself, she can't qualify for premium subsidies to afford coverage for her family. Cover her, but not her family. But we're going to change that. Once today's proposed rule is finalized, starting next year, working families in America will get the help they need to afford full family coverage. Everyone in the family.
It's a real drawn-out applause.
As a result, families will be saving hundreds of dollars a month. With this change, it's estimated that 200,000 presently uninsured Americans are going to gain coverage. Nearly 1 million Americans will see their coverage become more affordable. This is considered one of the biggest things my administration can do: lower cost and expand coverage.
That proposal from the president fostered a response from Representative Virginia Fox, Republican of North Carolina. She wrote this in part saying the supposed fix would weaken the firewall between the ACA and employer-sponsored insurance, placing more individuals on government-controlled health insurance. This expansion would also drastically increase the cost of Obamacare for taxpayers, exacerbating the economic hardships our country is already facing. The Biden administration is clearly doing everything in its power to chip away at employer health coverage, which has been the backbone of health insurance for decades. This is a massive mistake and will bring our country one step closer to a socialist healthcare system.
I'm starting to feel like that's not that bad. Bernie Sanders had like a report that when he was running and trying to give everyone free healthcare instead of creating a public option, he had a report that pointed out how much lower the costs get after a more like public, universal healthcare system is applied. I can't tell you the numbers because I haven't seen that paper in a really long time, but it was pretty substantial. We were saving millions and millions, hundreds of millions of dollars. She could be right about paying more taxes, but I wouldn't expect you to be paying too much more. Like if it's just an adjustment to get families on the plan, which is also something that you would want, and like if they are able to expand, who qualifies for benefits, like that's also what you want. It really doesn't affect the people. I mean, it does kind of affect the people who are privately insured because now they have to pay for their own insurance and they have to pay taxes for the Affordable Care Act. That's kind of bullshit. But at the same time, they're helping their fellow man. They're literally saving lives for the people who actually need it. For the people who actually need it, Affordable Care Act seems to be really
He is the ranking
substantial.
member of the Education and Labor Committee. The comments of Representative Virginia Fox, Republican of North Carolina. Lou Green off of Twitter saying the ACA deals with payment for health care, not health care. Americans need a guarantee plan to get health care and means to quickly appeal decisions such as short hospital stays, more options for surgery, and expert communication between doctor and patient, not clerks. Lynn from our Twitter feed just adding to a comment saying, I just want to say that Medicare is not free. And then Rebecca Stoner off of Twitter as well saying that the Republicans wanted to end Obamacare. What's their plan for replacement? Let's go to Frankie in Nashville, Tennessee.
That's always the question, okay? Conservatives' favorite thing is to repeal and replace, but they always do the repeal and never do the replace. You should always ask what they're replacing it with. And if they don't give you an answer, you don't let them repeal.
Line, good morning.
Good morning. Thank you for taking my call. I am a real supporter of the Affordable Care Act in that I have suffered my entire life from a condition of keloid scarring, which is now has been determined and changed to be called tumors. And in my life, I always had health care through my job. My health care never covered me. I was a patient at a really great hospital here in Nashville, Vanderbilt, and my doctors wanted to treat me anyway. And I could hear them on the phone with my insurance company screaming at them saying, you know, this lady needs coverage. One day, my doctor walked in and said, the law says we have to treat you. And I said, I'm covered? Because it was the first time in my life my insurance ever covered me.
Wow.
And I would always think to myself, if you're my insurance company and you're supposed to take care of my health care needs and you don't do it, where do I go? I didn't want to live off the government. I was a hardworking human being. So I am thankful for the Affordable Care Act. It changed my life and forced my insurance to do what it had never done before.
From John in Washington, D.C., Republican line. Good morning. You're next.
Hi. Yeah, I just wanted to say that the term health care is a misnomer. It's really sick care because if you pay high premiums and you're healthy, you're just throwing money out to subsidize the sick people. I want to know what happened to personal responsibility. How can a 350-pound person with a cigarette in their mouth say that health care is a right? Health care is not a right. Your lifestyle, your diet, your exercise, and your sleep, that's going to determine your health.
So how would you apply, because we're talking about the Affordable Care Act, what is your comment on what you think it's?
You know, my hopes would be that the Affordable Care Act starts, and this would be weird as hell, but the Affordable Care Act starts expanding toward wellness. We might see like maybe an Affordable Wellness Act emerge out of an Affordable Care Act. That would be ideal because a lot of the people who say this stuff, they have a point. That's how you stay healthy. You eat right, you don't smoke, you know, keep your stress low, you keep your blood sugar low, keep your cholesterol down. Moderate, you know, but like poor people don't get the luxury of being as modest. Like when you're in fight or flight mode that long, kind of just doing everything you can to cope.
It's done over the years. It's been enacted.
Well, what I'm saying is healthy people subsidize sick people, and it's not fair because healthy people live a healthy lifestyle. They don't need doctors. But they want it because they want to have their family covered just in case you have an accident or a catastrophe. But they don't get the diabetes and the heart disease and the limbs cut off and the things that cost millions and millions of dollars. Some people get cancer, but for most people with a healthy lifestyle, I haven't gone to a doctor in 20 years because doctors usually give you bad advice because they're just in it. You're just a customer to them.
No, you're not.
Tracy, Hendersonville, North Carolina, Democrat.
As a child of doctors, I can tell you, you are not a customer to them. They don't get paid by commission. They get paid by the hospital. You might be another customer to the hospital, but the doctor who's treating you is the line of defense between you and a bureaucratic fuckstorm that is going to just like keep you away from your insurance coverage, that's going to keep you away from your, it's going to keep you, it's going to keep you away from the proper care you need. Like, these people, like, the business side of hospitals are awful. There are a lot of people who don't see why things need to be there because they never grew up and they never learned in the medical field. They came from admin and they moved into health admin. That's what happened. They're business administrators. They're marketing, it's econ majors, business majors, administration, like hospitality. These are people, like, you can, and you should, if you're interested in healthcare. Healthcare admin is an important field, and they need more specialists, and they need more healthcare consultants too. Those are important jobs as well. They were especially important during the pandemic because a lot of hospitals didn't actually know how to take proper pandemic measures. So they would hire health consultants to kind of get them started. But yeah, like, nurses and doctors and what have you, they don't get paid by the client. They get paid by the hour. They get paid they get paid a regular, fairly consistent wage. There's no bonuses involved in how many patients you treat. There's no quota to meet. There's nothing like that. It's not a business as far as that is concerned. Where you do get fucked over is when your hospital starts implementing stupid policies to save money. That's when you start getting fucked over, because that's when you stop getting like the proper, that's when you stop getting the proper treatment and the proper aftercare when you've like had your operation and you're recovering in the hospital and stuff like that. That stuff matters a lot more. Anyway,
Brad's line.
Not a business. Okay. In fact, on behalf of my mom and my stepmom, these people probably give more of a shit about you and your health than you do, okay? And they probably give more of a shit about your well-being than they do about their paycheck. Although the paycheck is nice, but I see a lot of people doing this because this is what they want to do. This is what they've trained their whole lives to do. And it's not because they look at you as a dollar sign.
Hi.
Hi, you're on.
Good morning. Hi. I just wanted to say that I have been on the Affordable Care Act for several years now. Pretty much, we moved to North Carolina from Maine, and I had it in Maine. I was self-employed. I ran a business that helped lots of children. And I didn't pay myself very much because I couldn't and run my business at the same time. I worked 7 days a week. And after about 12 years, I found that I had a very loud heart murmur, probably from not ever taking a break. And I had to have open heart surgery. And I never would have been able to make it through open heart surgery without being on the Affordable Care Act.
That's so stressful.
My husband and I paid for insurance through jobs many, many years.
Open heart surgery has to be one of the most stressful operations you can take. Like, oh my goodness. Like, what do they do with your rib cage? I have to know now. Never mind, no. But God, it has to be so stressful.
About 30 years. And we paid a lot of money for the insurance when we paid through jobs. And we have to pay for health care now. But I'm just saying, when you're self-employed or you don't have a large income, you can work as hard as somebody that has a large income and gets insurance through their employer. But especially when you're self-employed and you can't afford to pay for your health care, this was a great solution. And
Well, if I may ask, what was the cost for your open heart surgery initially, and then what did you actually pay under ACA?
That's a good question.
It would have been over $100,000, and it was about $30,000. And so I paid the amount that was due over several payments, and it allowed me to have that surgery. Otherwise, so I kind of resent people saying, that this is just for people that don't want to work or just for people that live unhealthy lifestyles, because I lived a very healthy lifestyle for the sake of my community, for the sake of my neighbors, and for their children. And I really worked very, very hard all my whole life since I was 13 years old. So I have to say it has been wonderful, but it hasn't been perfect. Nothing's perfect. Not one single thing is perfect.
Yeah, Tracy, thanks for sharing.
I mean, despite her saying it's not perfect, she said it was wonderful first. Like that tells you so much about when this thing can actually help, like where it does, when it actually can. It's really, like, this is like this is a game changer to some people. This is an absolute game changer to some people who like normally wouldn't be covered by normal insurance. And that's the thing too, all right? Insurance companies, if you want to talk about who's got the business, like who's got a business mindset, it's insurance companies. They literally won't cover certain disasters that happen because they're too frequent and it costs too much money to fix. Like, they're not in it to actually help you. They're in it because they still get more money covering your car crash than you necessarily get, like, paying that premium. Like, it's... like, it will cover what is affordable and what's profitable. And if they can't get the deals like they do with the medical industry, if they can't get the deals like they do with the auto industry, they're probably not going to cover a lot of like weirder things like that. And edge case medical things, like I've really never heard of MS getting covered under insurance. It might. But like then there was that one lady who had her little tumors or whatever. Like that wasn't covered her whole life. It's like, like the government actually might give a little more of a shit about those niche cases than your private insurance does that's actually trying to make a buck off of you.
Your experience, let's hear from another North Carolinian.
Insurance wants to take your money and it wants you to stay a perfect human being forever. And that's why the moment you fuck up, they get to hike your premium up. Like, they don't want to actually pay for your stuff. And, like, they're going to punish you once they do.
On a Republican line, this is John in Mooresville. Hi.
Good morning, Pedro. Thank you for taking my call this morning. I just have to wonder why it is, if this is so affordable, that the Congress, including the House and the Senate, and all the federal employees are not on the Affordable Care Act. I just, for the life of me, I can't figure out why.
It's supposed to make health care affordable.
It's so wonderful that they don't consider putting all those other federal folks.
Because private insurance, if you still make enough money, might still provide you a better plan. Plus, like, I don't know, maybe maybe Congress has their own insurance, But like, this is about making it more affordable for people, not for politicians.
The first caller had mentioned the fact that Congress, unless they have their own health insurance, also had to option into buying into the ACA. That was the first caller's comments this morning. But
very
ahead,
interesting.
Finish your thought.
He's like, I got.
Well, I just actually, I'm a retired federal annuitant, and I recently, just a couple of years ago, broke my hip, and
oh, that sucks.
Just the surgery was almost $60,000, and I didn't pay a penny out of pocket, not a penny. My neighbor up the street has Affordable Care Act. He broke his arm, and it cost him almost $10,000 to have his arm repaired.
Mm-hmm.
So, you know,
I mean, it's not like if you're a good client to your insurance, it's not like they're not going to cover you. You know, it's just like the difference here, and they're probably going to provide you with better coverage than the government. That's probably true too. This isn't for people who can afford insurance. This is for people who can't. And the people who can't, even paying $10,000 over a period of increments is still a lot better than paying the whole 60 or whatever that it would need to fix that broken arm. Like, kudos to this guy for not having to pay a cent, but he was paying that this whole time with his premium.
I struggle to try to figure out how it is that it's supposed to be so great if people who can't afford insurance to begin with, then if something catastrophic does happen, that they end up with a $5,000 or $10,000 bill, and like the lady who just spoke, $30,000 for open heart surgery. You know,
$30,000 for a 100,000 operation. All right, she's paying 30% of what she would normally have to pay. That's significant. That's huge. She actually paid that off. She would still be paying that likely if it was $100,000. You know, like, think about it. Like, think about, like, what's double 30? Double 30 is 60. All right, it's not even 100 yet. Like, like, when you get to that, like, number range, like, you're not talking, like, add double the time to how long it's going to take for you to pay off that debt. It's going to be a lot longer than that. That's, you know, I don't know if they have any interest on it. I hope not. But God, dude, $30,000 is so much better than $100,000. She would have had to pay $100,000 because she couldn't afford it. Like, here's the alternative, okay? You can't afford health insurance, so you don't have health insurance. That's it. You're not on the Affordable Care Act. You don't have any other option. All right? You can't afford health insurance, you don't get it. So next time she has to get surgery, or like, so if she had to get open heart surgery and the Affordable Care Act didn't exist, she would have paid $100,000. And you know what that guy probably would have said? She didn't work hard enough for her insurance or some shit.
No, bless her heart. No pun intended there. But
God bless her heart.
Yep, you got your point in, John. Thank you for calling in. I'll point you to a story from NPR back in 2017. The question was asked, what type of insurance do our elected representatives in Washington, D.C. have? Is it true they're insured on the ACA exchanges now? And then any repeal and replacement will affect them too. This story is saying that under the Affordable Care Act, members of the U.S. House of Representatives, the Senate, and their office staffs who want employer coverage generally have to buy it on the health insurance exchange. Before the ACA passed in 2010, they were eligible to be covered under the Federal Employees Health Benefits Program. This adding that people working for congressional committees who are not on a member's office staff may be still covered under that. This at the time saying the members of Congress and their staffs choose among 57 gold plans from 4 insurers sold on the DC HealthLink small business marketplace this year. Again, this story goes back to 2017. So
yeah, I figured they'd have their own government health plan.
You can see more there at NPR. Ralph in Kentucky, Independent Line. Hi there. We're talking about what you're thinking on the Affordable Care Act. Go ahead.
Yeah, of course those members have the gold plan. Of course they do. I myself was on the job for 27 years, and I wound up having 2 open heart surgeries. The first one was covered by my insurance at work, and I went back to work after it. When I had the second one, I wound up being terminated while I was recovering in the hospital by my job after 27 years. And I was on the Affordable Care Act for a year. And the deductible, that's the question you need to be asking these people, what kind of deductibles they're paying. My deductible for the first year was $500. After that, it went up to $5,000. How can anyone pay $5,000 deductible? You see what I'm saying?
Mm-hmm.
I mean, and I'm in good health. I weigh 150 pounds, the same weight I was when I was 20 years old. I'm not obese or anything. My disease was hereditary. It runs in my family, coronary artery disease. Okay, so I tried to eat well and all that, but a doctor told me it really wasn't going to matter because it runs in my family, and I was going to have it anyway.
That's so rough. If you're still 150 pounds, what's your secret?
It's just a family thing. There's no, people are skinny in my family. You know what I mean?
Mm-hmm. Yeah.
It's just a family thing. But the best question you can be asking these people is, what are the deductibles that they're paying on this insurance? And when it went to $5,000, I couldn't afford that no more.
Okay, that's Ralph sharing his views from Kentucky. There, thank you, Ralph, for giving your input on that. A couple of things to watch out for on Capitol Hill today. The House voted today, according to the New York Post, on whether to hold former advisors to President Trump, Peter Navarro and Dan Scavino, in contempt of Congress after their months-long refusal to comply with subpoenas from the House committee investigating the January 6th attack on the Capitol. If approved as expected, the criminal referrals will be sent to the Justice Department, which would decide whether to prosecute. Also, at the House Energy and Commerce Committee today, they will hear testimony from 6 oil company executives about their business practices and the fossil fuel industry's role. You can see that live today, 10:30 on C-SPAN 3. You can also monitor it on cspan.org. Watch also on our C-SPAN Now app. Let's go to Greg in Alabama, in Huntsville, Republican line.
Hey, Pedro. Hey, I got a couple of quick comments on it. One, I was a little disappointed at the execution at the beginning of this thing when we started off and it collapsed. With the world's largest economy, it collapsed, and no interstate commerce, no bricks and mortar, just a website. Collapsed on the world stage there as we opened it, and we had people like Pelosi saying, we'll just have to pass it to see what's in it. That made me a little nervous, but I was super excited because I wanted cheaper health care. But the numbers tell a story. 264 million people had health care insurance at the time. 293 million people have health care insurance now. We keep hearing 20 million people would lose their coverage. It's really 29. 29 million people have health care insurance that didn't have it. But we now pay 147% more. My insurance went from $710 to $1,820. $1,820. I guess my question is, if 264 million people now pay 147% more, let's just take the 47% off and just say it was the cost of medication, the cost of facilitation of the program, and just increases through the past 10 years. Let's just give it to them. Let's just say 100%. We paid for 264 million more policies and only got 29 million people more insured. That just doesn't add up to me. How about you? Okay. I'd love to know where that money goes, because I write my check to the insurance company, and they go up every year, far exceeding what the cost of living is. I just can't figure it out, Pedro. Do you know where the money's at?
We'll let other people respond to that if you wish, Greg. Let's go to Robert. Robert in New York, Democrats line. Hi.
Hey, good morning. With regard to the health care plan, I'm still waiting for President Trump's new plan to come in. We've heard about his health care. Where is the plan? No plan from the Republicans at all. No alternatives at all. All they do is complain about how bad something is with no alternatives. All the criticism, Obamacare, but he got health insurance for people who needed health insurance. And the fellow in Pennsylvania, a few calls back,
he's gone.
Oh, I apologize. Danny in Arizona, Republican line. Hi.
Hi. Good morning, and thank you for the opportunity to say something. And what I'd like to say is in praise of Senator John McCain. This man dedicated his life to the service of his country. We all know his story, and he, because of him, he voted for Affordable Care Act, and it's there. Medical is a sense of dignity, and back and forth wherever the argument is. We're all saying that. It's a sense of dignity. But the courage that John McCain, as a Republican, put forth is the courage that we need the Republican Party now, not those four guys who are attacking Ketanji Jackson. Not, I mean, they'll have their.
And so to applying this to the Affordable Care Act, how would you do that?
Well, you know, I'm not saying that I'm wise enough to know. Obviously, I think the public option is going to come into effect, and I believe it's going to be sooner rather than later across the board, because people are going to realize that yes, there are struggles, burps here and there, but affordable health care must be had for all people.
Okay, that's Danny there in Arizona. Back to the White House from yesterday.
You know,
again, former President Obama.
I have heard a lot of people talk about how like affordable health care for everyone should be a right on this, and that's really surprising to me. You know, like I feel like maybe a few years back we probably wouldn't be seeing the same responses, but it feels like people are seeing the benefits enough that they're like, well, let's take it a step further.
There, during the time he talked about the ACA, he also had a bit of sporting fun with President Biden about the return to the White House. Here's a portion of that from yesterday.
Thank you, everybody. Have a seat. Have a seat. Thank you. Vice President Biden, Vice President. That was a joke. That was all set up.
That's really funny. Cracking jokes.
It's good to be back in the White House. It's been a while. I confess, I heard some changes have been made by the current president since I was last here. Apparently, Secret Service agents have to wear aviator glasses now. The Navy mess has been replaced by a Baskin Robbins. And there's a cat running around, which I guarantee you Bo and Sonny would have been very unhappy about.
Again, more of that available at the website in our C-SPAN Now app. Roll call reporting this morning about another aspect related to health, saying the week is young, but prospects for getting a bipartisan supplemental aid package for pandemic response efforts to President Biden's desk before a 2-week recess seem increasingly remote. Without a deal on amendments Republicans want to offer, the Senate on Tuesday rejected a procedural motion and needed to begin debate on the bill, which would provide $10 billion for the Department of Health and Human Services to buy more therapeutics, vaccines, testing supplies, and prepare for future virus variants. Utah Senator Mitt Romney, the lead GOP negotiator, said the underlying bill will have enough bipartisan support to pass if leaders can agree on an amendment process, but it's an open question on whether it will get done before the recess. You hate to have it delayed by 2 weeks, but it wouldn't be the end of the world, said Senator Romney, I hope, adding. Let's go to Gary, Fletcher, North Carolina, independent line.
Yes, sir. Hi. Thank you for letting me talk. I have a 2-point question. I heard our president say, this new plan, I'm going to save people hundreds of dollars a month and give them more. Now, that's what I love about being a Democrat. No other business can run that way. Number 2.
Well, you're calling on our independent line. Are you an independent or are you a Democrat?
Or are you Republican?
I'm a Democrat now.
Okay, I'm gonna have to pause. I'm gonna pause you there only because, again, you know, people I hate to be this way, but call in on the line that best represents you. If you want to, Gary, give another shot, call in on the right line. Please do that. Joyce, Tampa, Florida, Democrats line. Hello.
Hello. I am a licensed agent in Florida, insurance agent, and I was really amazed how many people never had insurance in their life. I'm talking about people that were in their 40s and their 50s. They were so happy to have affordable care. It was like a miracle for them. And also, I even talked to some people whose children maybe had lower paying jobs. And at that time, they were going ahead and paying for the premium. But I feel that we should have a universal health plan like they do in so many other countries.
Okay. Joyce in Tampa, Florida. Kelly is next. Kelly from North Carolina, Republican line.
Hi. Hello, America, and God bless you. I wanted to tell you my experience with the Affordable Care Act. We had Blue Cross Blue Shield, and we were paying about $465 a month. And then suddenly the Affordable Care Act came along. Oh, by the way, I have chronic Lyme disease and have for 18 years now. And when the Affordable Care Act came along, every year they raise your premiums. Well, within just a few years, they had raised our premiums all the way to $2,250 a month. My husband has his own business, so we have to do individual. And in the county I live in, the only insurance company you're allowed to use is Blue Cross and Blue Shield. So they took advantage of it. And our deductible was $5,000 on top of that. So we have just totally gone without insurance because we can't afford it. It's cheaper to go to the doctor and tell them you're self-pay than it is to pay for the insurance.
Kelly
it's
there.
Really bad.
Kelly there in North Carolina sharing her experience. Several minutes left, about 7 or so before we move on to our first segment. If you want to give us your thoughts on the Affordable Care Act, again, this from the White House yesterday, and that event's still available at our website at cspan.org. 202-748-8000 for Republicans, 202-748-8000 for Democrats and Independents, 202-748-8000 to text us if you wish to at 202-748-8003. Roger, up next, Abilene, Kansas, Democrats line. Go ahead, you're next up.
Yes, I before the Affordable Care Act came in, I had just a regular policy, and I believe it cost right around $475 to $550 a month. When the Affordable Care came in, of course, that premium that I was paying went up and up and up, and it was up to about $1,800. I went probably 1 year without insurance. By the grace of God, we are a healthy family. We have no issues. And anyhow, we got along okay, and then I finally decided I had to get affordable care. So I went and got affordable care. It was a very low premium. I think it was like $350, but we did have the $5,000 deductible. I just went ahead and continued on because I knew I was getting close to being able to get on to Medicare. And but the last year before I got on to Medicare, my wife and I both had small issues that each cost us $4,800 per incident, which meant we didn't even meet our deductible, so we had to come up with the money. I'm not really. I believe the Affordable Care Act is not as good as it should be. Now, in our community, there was a small company that had probably Kansas-wide. They probably had 500 to 600 employees. They had insurance, and it always shocked me that they got taken over by a company named Koch Industries. They told me their insurance went from like $600 a month down to $75 a month. Now, why can't our government go to Koch and say, hey, how did you do this?
Okay.
Tell us how it's done. Okay.
Roger in Kansas. Thank you. Pat in Ringgold, Georgia, Independent line.
Hey, thank you. In the last decade before Obama, I felt like my total insurance cost stayed around $400, $450 a month. And my employer would pay roughly 3/4 of it, and I would pay the other fourth. Then after I got on Obamacare and my plan came in, my total just shot to the total cost shot to $900. And it just doubled. And yes, the government did pay 90% of it instead of, 75% that was my employer before. But there's no free lunch, and and or free health care. So for me, I saved a few bucks, but I was suddenly living off the government, and it to me was shameful because I just look at the whole big picture. I mean, now health care costs that times 300 and something million people. And I did think it was great about the pre-existing condition clause, and I do applaud Obama for that. I was hopeful about the whole idea, but he did come on TV and lie to everybody about you can keep your doctor and insurance, because my doctor would not take Alliant. I only had two choices in Obamacare, and my doctor wouldn't take Alliant, and so I lost my insurance company and my doctor.
Okay.
But, the last month I was on Obamacare was in December, and my premium had gone up to $1,162 a month, and that's in Georgia. So that's not sustainable, and it makes the price of health care go up for everyone who doesn't qualify for insurance.
Okay. That's Pat in Georgia. Another Georgian, this is Dale in Cochrane, Republican line.
Good morning.
Morning.
I just got one or two questions. Since Obamacare is so good, and I know these people need health insurance, but before Obamacare, when a person got sick, they go to the emergency room, and the government still paid for their health care. And why didn't, if Obamacare is so good, why don't Congress and the Senate go under the same program?
Again, I'll point you to that NPR story I pointed people earlier if you want to about Congress and their eligibility for the Affordable Care Act. But go ahead and finish your thought. Oh, he hung up. Catherine in Oklahoma, Democrats line. Your last call on this. Hello.
Hello. I'm an insurance agent, and I've seen a lot of things in the last 30 years about health insurance. Mostly, in my opinion, it's a rise of healthcare costs and the fact that it's not like a consumer-driven product like a lot of other things. But the thing with the Affordable Care Act, the prices are going up, number one, because the mandate went away, so not everybody is in the pool anymore. Health insurance companies aren't really making that much money on it because of the cost of health care. But another thing, it hasn't been funded the way it was written in the legislation. So the funding of it, it hasn't been proper. That's just my opinion of it.
Okay.
That's all I have to say.
That's Catherine in Oklahoma, finishing off this hour. To those of you who called, thank you for participating. Several guests joining us throughout the course of the morning. We will hear first up from Republican Congressman Mike Burgess of Texas. He's going to talk about the ACA, Title 42, which you've heard in the news. Also today's hearing with oil and gas executives. Later on in the program, we'll dig into those proposed changes to the Affordable Care Act with Joanne Volk. She's with Georgetown Center for Health Insurance Reforms. Those conversations coming up. We do want to note something that happened, an announcement that happened yesterday. 18-term Republican Congressman Fred Upton from Michigan announced his retirement on the House floor yesterday. Here's that moment, and you'll also see a moment with his friend and fellow Michigander, Democratic Congresswoman Debbie Dingell.
Even the best stories has a last chapter. This is it for me. I've done the zillions of airline miles back and forth. I've signed Fred to over 1 million letters, cast more votes than anyone in this chamber while here, and by most accounts have succeeded in making a difference, accomplishing what I've set out to do with more unfinished work still yet to come. Arthur Brooks recently wrote about 3 traits most important in life: honesty, compassion, and faith. I'd like to think those same yardsticks were passed along to me by my parents watching on C-SPAN now. Someone asked my wife, Amy, what would be the next chapter? She said, and they lived happily ever after. Indeed, we will. I want to thank Amy, our 2 kids, 3 grandkids.
Washington Journal continues.
If you want to participate in open forum, you can also text us at 202-748-8003. The New York Post picks up on a story about some action on the Senate floor yesterday. The reporter writing that 2 Republican senators released new documents detailing financial ties between the Biden family and, quote, corrupt actors in Ukraine, Russia, and China during a lengthy presentation on the upper chamber's floor on Tuesday. It's their third address on the subject since April the 28th. Senator Chuck Grassley of Iowa and Senator Ron Johnson of Wisconsin spent nearly a half hour following up on their September 2020 report about Hunter Biden's business dealings in Ukraine. You can see all of this presentation on our website at cspan.org. But here's a portion from the Senate floor with Senator Chuck Grassley from yesterday.
We'll hopefully watch that later.
Senator Johnson and
I've been saying for a couple days that I'm going to do kind of a history of Ukraine crash course, and I decided I'm going to do that on Friday. The way my classes are spaced out right now, I have to go to class from 8:30 to noon, like 12:30, and then I tend to do a lot of stuff afterwards just to kind of get my day all put together and make sure my deadlines are met. So with that in mind, my Fridays are actually my easiest days. I only have one class at 9 a.m. and then I'm done at 10. So I'm just going to skip the morning stream on Friday, and we're just going to move straight into kind of a lengthier, more informative stream about the history of Ukraine and more specifically how Ukraine's affecting the world. I don't think this. I know this for a fact. People are not looking at right things when they're looking at the war in Ukraine. They're trying, I ended up talking to someone at my Walgreens the other day. She's more focused on, is this a cover-up from, Hunter Biden's emails? Or, the Biden administration as a whole, and it's first of all, in order for that to work, you literally are saying that the world government, every government in every country in the world has the same interest in defending Hunter Biden and Joe Biden and not even their administration, just them. And also, the Biden administration, so all the people working under him, including the Attorney General, the Secretary of State, Secretary of Defense, the FBI, the CIA, all of these people, you tell me, are in cahoots with it too, and they're all we gotta defend Hunter Biden, and we gotta defend Joe Biden, because, it's when the reality is, this is the reality of it, this isn't even on the radar for some people like the FBI, okay? FBI has had the laptop for a few years now, or a couple years at least. And we got pretty much everything we got out of it. But people, as far as that is concerned, it's a nothing burger compared to what's happening in the Ukraine and why. I think when you take it from Russia's perspective, you can simply say that Putin's trying to leave a better Russia than he found it, okay? When Putin came into power, he came into power under Yeltsin. It was what was considered the end of history, or declared so by some communists, because the Soviet Union is breaking apart, which is what, at least, some people like Putin thought to be, Russia at its prime, and a lot of people felt that way. It kind of was. It was its own Eastern Bloc. It was its own empire, in a way. And I think it's simply enough, Putin's trying to restore that, and it's, not very unrealistic for him to want to do that by taking back all the countries that he thought that used to be part of the Eastern Bloc, Right now, what we're seeing is a Iron Curtain coming over on the horizon, and it's just shifting a little more to the east than where it was originally. There's a lot of world factors and a lot of geopolitical reasons this is happening, and there's a lot of consequences about it too. We're gonna see here in the next month famines in really, really small countries around northern Africa and in the Middle East, because these are because these countries rely on almost all of their wheat production to come from the Ukraine or Russia. And both of these countries are not going to be harvesting this year. Especially Russia's having a really bad time dealing with trade sanctions and everything like that. There are a lot of trading companies that will no longer ship out to Russia and no longer export for them, which means that they're having they're having an economic crisis. Their economy's tanking right now. But on the top of that, they are such a huge provider of natural gas and wheat that, these other little countries are not going to be getting the supplies they need and might be entering a really unstable position. And that kind of just gives fruit for extremism to come in place and to take over those countries. And so we might start seeing more radical regimes emerging out of the instability of these locations. But this isn't a matter of how do I put this? It's really convenient for us to do what we're doing. We just cancel Russia. It's really easy for America to do that. It's not easy for Europe to do that. Europe relies heavily on natural gas coming from pipelines in Russia. And Russia is a vital part of the world economy. So this is almost like we're walking a fine line here. We need to tell Putin that he can't do this, but we're also not trying to destroy everything we have with this country, because this is a powerful asset to our allies. And we want our allies to remain strong and to remain dignified and to remain capable, because then they help us. Right now, they're doing a lot of the heavy lifting in the Ukrainian war for us. We just provide weapons and ammo, and we keep our troops in Poland. Whereas the NATO stuff and fortifying NATO has been left up to Europe. Anyway, I hope that more people can just see this for what it is and see this as a country fighting for their right to survive and be their own country. And I hope that people realize that even if there was instability up until this point, and there was, it wasn't unstable enough for them to revoke their rights of being in Ukraine. It wasn't, at the end of the day, these people, a lot of the people who, caused the turmoil or whatever, they stayed in the country. And they kept, they care about their country. And it's just this is about their right to freedom, their own freedoms. And their right to solve things within their country as they want to. Could you imagine for a moment if Russia decided to police America the way that they are policing Ukraine right now? If they decided to go, you have too many Nazis in your country, so we're going to invade you. Oh, you piece of shit, cat. Anyway, I'm going to go beat the crap out of my cat.
We're right 2 years ago. We knew it then, but it's been a long road to defend our work product. The liberal media and our Democratic colleagues aggressively tried to make the case that we were peddling Russian disinformation. Now, what will the liberal media and my Democrat colleagues say now in light of last week's Washington Post article that substantiated the work that Senator Johnson and I have been doing? We still haven't received any apology from our Democratic colleagues for their false claims against us these past several years. They haven't apologized to the American people, and I'm not going to hold my breath. When will the big-time media in Washington awaken to respect my reputation for the thorough investigative and oversight work that I do as a senator? And it's also my constitutional responsibility to do exactly that.
Again, that's on the Senate floor yesterday. Also, Hunter Biden becoming a topic of discussion at the White House press briefing yesterday, an exchange between the White House Press Secretary Jen Psaki and Fox News' Peter Doocy about the Department of Justice ability to investigate issues concerning Hunter Biden. Here's a portion of that exchange.
To ensure the independence of the investigation, would the president support the appointment of a special counsel?
Well, first, the president has never had a conversation with the Department of Justice about any investigations into any member of his family. He said that during the campaign, and he will continue to abide by that. So I'd point you to the Department of Justice for any additional steps they would take. They would make those decisions independently.
Is there any concern that they're not going to be necessarily seen as being able to make the decisions independently if the White House Chief of Staff is out saying that the president is confident his son did not break the law?
Well, that's something the president has said, and certainly we would echo. But in the same answer to that question, Peter, during an interview this week on ABC, Ron Klain also said the Justice Department is independent and they will make their own decisions.
And the president has said that he never spoke to his son about his overseas business dealings. Is that still the case?
Yes.
Again, you could see more of that at the website and our C-SPAN Now app. We'll start off with Nancy in this open forum in Connecticut. Democrats line. Hello.
Hi, I just want to remind the people that called from Kansas and Georgia that it's their own states that is making Obamacare so high there because the red states have not expanded Medicaid like the blue states have. My friend here has a $1,000 subsidy because he's low income. He only pays a few dollars a month. Yes, there are deductibles, but it doesn't apply when he goes to the PCP. He's had only like $20, $40, or $60 copays. And I want to remind people that prior to Obamacare, I had to pay well over $1,000 a month for 10 years from age 55 to 65 for private insurance. I had a $5,000 deductible. And believe you me, if I had gotten sick, they would have increased my premiums so high I couldn't afford it, or they would have dropped me. And they were very nasty. Obamacare doesn't do that. They don't drop you if you get sick. They don't increase your premiums because it goes on your income. Okay. So I just want to let the red states know that it's their own state government that is making their prices so high.
That's Nancy in Connecticut. We'll go to Gary in Albany, New York, independent line.
Yes, hello, how you doing?
Fine, thank you.
My question is, with this Build Back Better plan, that's probably not going anywhere, but it's the you know, you're paying for people's kids. People have kids, you got to pay for their child care. People have kids, pay for your own child care. I don't care if you have 10 kids. Well, why do taxpayers have to subsidize that? And
your tax money goes to the school district.
On the Russia investigation, what the Democrats had.
This is also, you know what? I'm just going to go off on this a little more. We need to start thinking about this. Something that it's not Louis C.K. Louis Black, I think, is the comedian. What does he say? Their kids are our kids. All right? It's not just his. I mean, technically, yeah, it's their kid, but it's everybody's kid. It takes a village to raise a family. It really does. You are part of the community, and you're part of these kids' communities. You're part of these kids' lives, whether you want it or not. Take care of them, even if it's just a little bit. This line of thinking ain't fair, all right? They didn't choose to have that kid. Like, they didn't necessarily... Not everyone gets to choose to have kids. And if it's going to be their responsibility, give them the choices to actually handle that responsibility.
Going 4 years cost us how many billions and millions of dollars. Adam Schiff called Trump a Russian agent. Where's his apology for that? He never had his proof put up. If somebody had said Clinton or Biden was a Chinese agent, they'd have him in front of Congress so fast their head would spin.
People are already kind of saying stuff like that. I mean, what's the Hunter Biden thing about? He's a shill for China. He's a shill for Ukraine. Like, and like, wasn't there that like huge report that came out from like, oh god, Axios? They did like a report on like kind of Russia finding Trump and like buttering him up and like grooming him.
New York, one of the news in the New York Times this morning, Ivanka Trump testifying before the January 6th committee. This is from Luke Broadwater in the New York.
And you know, when stuff like that pops up, you know it's true when they don't talk about it. They just gloss over it. Because that was another thing that Republicans would be caught dead if they ever talked about stuff like that.
New York Times saying it was not immediately clear how revelatory her testimony was for the committee. But those familiar with the interview said Ms. Trump did not seek to invoke any privilege, such as executive privilege or the Fifth Amendment, as other witnesses have done, and broadly, if not garrulously, answered the panel's questions. She was one of several aides who tried to persuade the president to call off the violence that ultimately injured more than 150 police officers and sent lawmakers and Vice President Mike Pence fleeing for their safety. More of that at the New York Times. We'll go to John in Virginia, Republican line.
Well, good morning. Yes, I was just wondering, I enjoy watching the show, Pedro, and listening to all the different opinions. And I've noticed sometimes you ask a follow-up question, which is good. But I was wondering, I get so sick of hearing when they're bashing Trump that he told 24,000 lies. I have no idea where that figure comes from, and I wish you could ask, because it's day after day after day.
Okay, that's John in Virginia. Speaking of Adam Schiff, The Hill reporting late yesterday that it was announced Tuesday that he had tested positive for a breakthrough case of COVID-19. The Hill story adding that he's vaccinated. He announced the positive test result in a tweet. That's reporting from The Hill. We'll go to Brenda in Pennsylvania, Democrats line.
Hey, good morning, Pedro. I've come to the conclusion that not enough people want to know the truth, and we don't have enough people that want to tell the truth. I called C-SPAN, I believe it was in December, and Bill Scanlon was the host, and I suggested that C-SPAN maybe give each state airtime to explain their election and ballot counting processes, and I suggested that C-SPAN help to squash the big lie, and I was disappointed in C-SPAN for not doing so. And I'm also disappointed that since I made that suggestion, no one calling in called to say that was a good idea. No one called in to say that would be good for C-SPAN to do this and let states explain their ballot, voting processes, so everybody across the country would have the same information at the same time. And I was just disappointed. And I want to remind Trump supporters that he left his supporters standing at the Capitol when he turned his back and walked away and didn't issue a blanket presidential pardon to all of his supporters. Thank you.
Let's go to John in North Hollywood, California, Independent line.
Hello, dear listeners. I'm calling about the American government agency, CIA. They're all low intellect people, working people in this agency. They keep mixing dangerous microorganisms in the food of American people around the world and in the United States. There is no law enforcement agency, police to arrest these criminals and put them lifetime to prison and shut down this dirty criminal agency pretending innocent people and harming people around the world.
Okay, that's John in California. Ken is up next on this open forum. Manassas, Virginia, Republican line. Hi there.
Yes, good morning. How are you this morning?
I'm well, thanks. How about yourself?
I'm doing well. I wanted to make a comment about the lady who called from Connecticut talking about
the red states and their insurance issues with Obamacare. I actually live in Manassas, Virginia, which was run by Terry McAuliffe, and to let her know that I have United Healthcare. And back when Obama, before he passed the Obamacare, my deductible was $2,000. Now I pay $7,000 deductible before any of my benefits kick in. So I think that these people who claim that Obamacare is so great and wonderful need to think about their consequences to others.
That's Ken in Manassas, Virginia. About 15 minutes left in this open forum. If you want to participate, the phone line's open to you. You can text us at 202-748-8003 if you want to do that. One of the committee hearings yesterday featured the Joint Chiefs of Staff Chair, General Mark Milley. It was before the House Armed Services Committee. He talked about the current situation involving Russia and Ukraine, but also talked about what he described that he felt was facing the United States and the broader world right now. Here's a portion of that testimony from yesterday.
Currently, we are supporting our European allies and guarding NATO's eastern flank in the face of the unnecessary war of aggression by Russia against the people of Ukraine.
I'll use it with Escobar.
And the assault on the democratic institutions and the rules-based international order that have prevented great power war for the last 78 years since the end of World War II. We are now facing two global powers, China and Russia, each with significant military capabilities, both who intend to fundamentally change the rules-based current global order. We are entering a world that is becoming more unstable, and the potential for significant international conflict between great powers is increasing, not decreasing.
A lot more to that hearing from yesterday. Go to our website at cspan.org to view it there. Also our C-SPAN Now app if you want to see it there as well. Michael is in Buffalo, New York, independent line.
Hi, how you doing?
I'm fine, thanks. Go ahead.
Okay, now my question is, why do laws overweigh our U.S. constitutional rights as a citizen? Like, I live in New York State, and it's unlawful to carry a firearm when this is our, given U.S. constitutional right. And another thing, the invasion in Russia. We keep posting stuff on these social networks, and it's like we basically giving them insight on what's going on our side.
Next line from Catherine in Minnesota, Cedar, Minnesota. Hello.
Hi. I wanted to comment on the crisis in Ukraine. It makes me feel just overwhelmed to see what's going on and this idea that we're not going in to try to help them, because obviously people are being slaughtered and it's changing the face of the world. And I just wish that we would go in and make a change, and that we would, make the statement by going in. I think just sending arms in clearly isn't enough.
So you're talking more of an official troop presence,
and like Ukraine's winning the war, and Ukraine said this too. Ukraine said, "Don't send troops. You don't gotta send us troops." Ukraine said, "Send us guns. All right, we'll kill the Russians. You send us the guns, okay?" And that's what we've been doing. And these past few years, we have actually been training Ukrainians. We're like, well, I shouldn't say directly, all right? We would train a dude. We would help train some people in Canada, and then one of the people in Canada would be from Ukraine, and then he went back to Ukraine and taught them everything they knew, type of stuff, So it's as much as I kind of wish the same in some respects, but at the same time, I don't, because we're doing everything that everyone's telling us to do. Zelensky wants guns. He doesn't want troops. He wants guns.
By those outside of those outside of Ukraine.
Yes, I believe it's necessary. I think it already could have made a difference. I'm just worried about what we're subjecting the people there to. And I do feel that this is a democratic country. We have gone in and we've had this presence and taken this risk in other places that didn't even feel like we did. So I feel like we owe this to them as fellow Democrats. And I just worry about those people. And then to the Obamacare, I'm not covered by an affordable care plan thing. I'm covered by my spouse's employer, and we have a deductible that is so large, it's crazy. And I just, I think they should have done something to minimize or capitalize, to capitate these deductibles so that we don't have such high deductibles, because with such high deductibles, you just don't know what could happen to somebody. So it really is a negative influencer.
Okay.
I do my best to try not to.
That's Catherine in Minnesota. A couple international stories in light of events in Ukraine in the recent days. The EU proposing more bans, specifically on Russian coal. This is reporting from the Washington Post this morning, saying the package does not meet demands for an embargo on Russian oil or natural gas. It is unlikely to quiet calls for the EU to do more. Quote, to avert the new Bushas imposed the mother of all sanctions, stop buying oil, gas, and coal from Russia. That was the Ukrainian foreign minister tweeted on Tuesday, stop financing Putin's war machine. This is the first EU move to block Russian energy imports since the invasion. That's reporting from the Washington Post. Other reporting out of Afghanistan. This is from the Wall Street Journal this morning under the headline, Taliban further constricts social freedoms. This is by Sune Engel Rasmussen and others, saying the Taliban in recent weeks introduced draconian social restrictions, which particularly curb the freedoms of women, even as the group seeks international recognition after toppling the Western Back Republic in August. Most notably, the Taliban last week decided to uphold a ban on secondary and high school for girls. They also banned live music at weddings. Women must be accompanied by a male relative when traveling beyond 48 miles. In parts in Afghanistan, women are required to be accompanied by a male guardian to receive medical treatment. More there at the Wall Street Journal. This is from Mississippi, Republican line. We'll hear from Lynn.
Yes, sir. I'm against Title 42 being ended. I have dreamers in my family. Also, I'm against the Jackson land being confirmed. Leah Thomas is a biological male, and he swims against women. Women are losing in the swimming contest against him, and they can lose scholarships. My daughter ran track, and she worked hard. All the women that are working hard to get scholarships are going to lose it to biological.
Nope, because that's not how swimming works. That's not how track works, all right? When recruiters are looking at your records and they want to see if you're good enough to join their college team, they don't look at what you placed in, all right? They don't look at the heats you placed in. They don't look at, they look at your time. They look at your score, okay? That's what they look at. They look at your personal best, because that's what it all is about in these sports. It's about personal best. Nobody cares that Usain Bolt is the fastest man alive, is faster than anybody he runs against at the Olympics. They care about how fast he runs, which is incredibly fast. And when it comes to Leah Thomas, anybody who's recruiting for women, they don't have to look at her time. Anybody who's looking at that event, all right, and they're looking at any of the women that Leah Thomas competed against. We're specifically talking about that situation, and we're talking about, did Leah Thomas's victory ruin the chances for every other girl in that pool to get a scholarship? The answer is no. It's no. Because Leah's just one person. And she's just one niche case. And when your colleges are recruiting for women's sports, they might look at her. But in this situation, they're not going to say, we were thinking about giving you a scholarship and we looked at your time and your time's really good, right? but because Leah Thomas beat you, we don't think that you're really cut out for this whole swimming thing. You know? Because Leah Thomas beat you and got a better time than you did and placed first in her heat, we don't really feel like all of these other times that meet our qualifications, we just don't feel like that's acceptable anymore. We're looking for more competitive women. Like, get the fuck out of here, dude. Get the fuck out of here.
Men, and it's going back in women's rights.
Look at that.
And I'm against the ESG, too. Also, with the ESG score, it's a social credit score that's going to punish oil and coal and gas companies. We have coal plants in Mississippi. We have refineries off the coast, and there's a lot of products that are made from oil, like 50 or more products that we buy in the supermarket.
And there's a thing that maybe we'll just watch. I think I'll watch Aristocracy's video on it on Friday or something. But, like, if people really care about defending women, like people are, like, doing this whole thing with Leah Thomas and they're freaking out because they think they're defending women. And, like, just a couple months back, like, at the very, like, right before the Ukraine war started in the Olympics, we saw a revolutionary phenomena take place in women's ice skating, to the point that the only way you're going to be competitive in women's ice skating anymore, which is a sport, by the way, an Olympic sport, is if you are 14 or 15 and have not gone through puberty yet, and you're just trained to the max to make jumps. And then once you're 16, your career as an ice skater is over professionally. That sounds way more unfair, in my opinion.
They will raise the price of those products.
Okay, that's Lynn in Mississippi. This is Susan in Iowa, Independent Line.
Hi, good morning to you.
Good morning.
I saw that you had Chuck Grassley on there a few minutes ago about Joe Biden's son, Hunter Biden. I don't mind if Grassley wants to investigate Joe Biden and his family. I don't care about that. I don't plan to vote for him in November, by the way. But it turns out to be, if they're going to go after the Biden family, then they better go after the Trump family kids who made millions of dollars off of China and off of Russia and the Emoluments Clause. Nothing's been done about that. So I don't care what party you belong to. Fair is fair on both sides, and they should do the exact same thing when it comes to Republican or Democrat, but get it out there. Thank you.
Jason in Pennsylvania, Democrats line. Good morning.
Good morning. My question is about the oil and gas prices. And everybody's blaming everybody why the price is, but I'd like to know what happens to in 2020 that the American taxpayers gave oil, gas, and coal $5.9 trillion in subsidies. Shouldn't that help keep our gas prices at a minimum? And that's my question.
From Dawn on our Republican line in Pennsylvania. Go ahead.
Good morning. I just think all one has to do is sit back, look around, and see what is happening in our world. I mean, everybody griping and complaining, but look how it is nowadays. My God, wanting to teach such terrible things to our kids in school, kindergarten up to third grade. They think they should discuss things that kids that young have no business even being talked about. And just everything. I just think the whole of government is so politically and so terribly corrupt that I think the majority of the American people are definitely on to all the corruption. Thank you.
That's Dawn in Pennsylvania. One of those people commenting on the Biden administration's decision to lift Title 42, as it's known, was Senator Joni Ernst, Republican senator from Iowa, the Republican Conference vice chair, issuing a warning to the Biden administration about that decision. Here's a portion of that from yesterday.
Now, the lifting of Title 42 is going to exacerbate this. So it won't be 7,000 a day. What is anticipated is that it will more than double, and we will see 18,000 people trying to cross the border illegally every single day. My home county of Montgomery County in Iowa has roughly 10,000 people. Double that, trying to cross our southern border every single day. This administration needs to get with the program and understand that our southern border is being crossed by more people than we can assist and help at this time. So we need to continue the pressure on the administration. We need to make sure that they are recognizing that if 1,000 people illegally crossing in 2019 was a crisis, we have got an absolute national security disaster on our hands in 2022. So again, we are urging the administration to...
It's kind of why we gotta stop calling it a crisis. Because it's not. It's just not. Like, there's no like, oh my god, what do we do? What do we do? What do we do? We kind of, with the people on the border, that's the crisis, okay? The crisis is not they're coming in. The crisis is that they have to sit there in the desert.
To rethink Title 42 and please secure our southern border.
By the way, later on in the program, we're going to hear from Representative Nanette Berrigan. She's on the Homeland Security Subcommittee on Border Security.
Title 42 was the biggest slam dunk that the conservatives have gotten in a long time. That's why they don't want to get rid of it.
She serves as the chair of that subcommittee, and we'll talk to her about issues regarding Title 42. That's going to come up at 9:30 Eastern today. Rick in Fairfax, Virginia, Democrats line. Hi.
Good morning. Thanks for taking my call. I just wanted to reply to the two callers who called in about the Obamacare and having differing opinions. And I just want to say to both of them, both of your opinions are valid, and I'm sure that your experiences reflect where those opinions are coming from. But when it comes to Obamacare, what really matters is on balance for the whole country, right? Was it a good move? And what we're seeing is that there are tens of millions of more people who have access to care, who won't suffer bankruptcy if they get hit by a car or have a sudden medical emergency. And I'll also add that Obamacare does more than just provide a marketplace for people to access care, access insurance to get them to care, but also has provisions to protect people from being kicked off, allows people with pre-existing conditions to be guaranteed access to health insurance. So there's more beyond that. And so on balance, and I don't want to negate people's experiences that they might have had bad experiences with their health insurance company. But on balance, it's done good for the country, protected people's health, and more of our fellow Americans are covered and have a better life experience as a result.
Okay,
so
well,
more broadly than yourself.
We'll go to Jim in Indiana, independent line.
Yeah, Pedro, first of all, I'd like to compliment you and C-SPAN. I think you do a great job. Been watching you for years. Talking about this, the energy program, really and truthfully, I feel that President Biden should be a little more like FDR was back in the 1940s, when we should open the spigot and let that oil flow and let that gas flow. It will not represent one more gallon of consumption to the world. It would just simply be in competition with Russia. It'll drive the price of oil and gas down $1 a gallon if they go to, and will also bring about maybe 100 or 200,000 jobs.
This is happening, by the way. We are letting the oil flow. Last week, Biden announced that he's going to be releasing 180 million barrels from the United States Strategic Reserve, and selling it to oil, selling it to gas companies, basically. So hopefully, in the next couple weeks, we start seeing cheaper prices at the pump.
It's a win-win for America. It's a win-win for UK, Korean. It's a win-win for even the climate.
But our strategic oil reserve is not going to exports. We're not exporting it. It's just for the American people.
That we're able to displace Russia.
Okay.
As one of the leading suppliers of gas and oil.
That's Jim in Indiana. A small disruption on Capitol Hill yesterday caused by a fox. Reporting in the Washington Post.
Oh, what a cute guy.
A small fox running around the Capitol grounds.
God, what a cutie.
In some cases, Representative Ami Bera said in a telephone interview that he was among them. He was attacked around 5 o'clock Monday. Actually, he said while walking near the Russell Senate office building, yesterday was probably my most unusual day in 10 years. He said on Tuesday, after feeling something lunge at the back of his leg, Bera said he turned around expecting to confront a small dog. Instead, he saw a fox and wielded an umbrella to keep the animal at bay. Let's hear from Jerry in New Jersey, Republican line. Last call for this segment.
Hello.
Hello. Good morning.
Good morning. I have two questions. I've been watching all this Hunter Biden laptop stuff, and everybody keeps asking, in his laptop, who is the big guy on Hunter's laptop? Now, if it's Biden, like we all assume it is, the millions and millions he's gotten from China and Russia, doesn't that compromise him? I mean, I'm sure it does. And the young lady that called about the Title 42, $2 million.
Here's a question to ask. Does any of the business dealings that Donald Trump made before he was president compromise him as to be the president? We said no to that, so why are we questioning the Biden thing? Because they weren't president at the time. It's it's a consistency question.
Illegals got into our country last year, and 1 million has already gotten in since October. It's been all over. Now, with COVID now coming back and breaking out, do you think letting in twice as many illegals would be healthy for the United States?
Okay.
I don't.
That's Jerry there in New Jersey. Last call for the segment. Thanks for all who participated. A couple of more guests joining us throughout the course of the morning. You saw yesterday the White House talking about the anniversary of the Affordable Care Act, and President Biden trying to fix parts of that. For that discussion, we're going to hear from Joanne Volk of Georgetown Center for Health Insurance Reform, talking about what's being proposed by the administration and the Affordable Care Act overall. Later on in the program, like I said, the chair of the House Homeland Security Committee border panel, Democratic Congresswoman Annette Berrigan of California. Those conversations coming up on Washington Journal.
C-SPAN has unfiltered coverage.
I like this caller. He was like the second one today. Like the third. Good morning to you. I saw it. Hey, what the hell? I was reading that. You don't get to just do that, okay? Why? Why does it keep doing that? Good morning to you. I saw you had Chuck Grassley on, and they mentioned Hunter Biden. I do not mind if Grassley wants to investigate Joe Biden's son. I don't plan to vote for him in November, but if it turns out to be, then they have to go after the Trump family kids who made millions of dollars off of China and Russia and all humans clause. Nothing was done about that. I don't care wherever you are born to. There's fair on both sides, and they should do the exact same thing when it comes to Republican or Democrat. But get it out there. Thank you. I agree. You should hold, we need to be, consistent, I gave Trump the benefit of the doubt at the beginning of his election, and I stuck to whatever I criticized him. I tried to stick to what he was doing as president that I didn't like. I didn't try to focus on any weird things like, oh, he's lying, oh, he's racist, or anything like that. I tried to focus on his policies, and I tried to focus on what he's doing for the country. He did not do a whole lot. He did some things. He did some things right. But, he didn't do a whole lot for the people. I'm going to give Biden the same credit, all right? Everybody who's doing this, everybody who's doing this, oh, Biden's like mentally deranged and is unfit for the presidency. Anybody who's doing the Hunter Biden and then make skeezy deals and is unfit for the presidency. Anybody who's doing the like yeah, like anybody who's doing that stuff, it's literally the same as everybody who did the, oh, Trump's a rapist and a sexist and a racist. Like, can't, if you're gonna blame people for Orange Man bad, you can't do Sleepy Joe bad. Okay? I mean, you are, but it's pathetic. Let's do this. Joanne Volk on the Affordable Care Act.
Or wherever you get your podcasts. Washington Journal continues.
Joining us now, Joanne Volk of Georgetown University, the Center on Health Insurance Reform. She serves as a co-director. Thanks for giving us your time this morning.
Of course, thanks for having me.
In particular, when your university does research on the Affordable Care Act, what kind of things are you looking for, and how would you assess the Affordable Care Act to date?
Our center has been tracking state implementation of the Affordable Care Act since day one, watching what the departments of insurance and legislatures are doing to implement the Affordable Care Act. The ACA sets a floor for minimum consumer protections for everyone, and states can always be more protective. And I would say that it's been a success in terms of the number of people who can now get insurance, even with a pre-existing condition, the number of people enrolled in coverage that provides subsidies to offset their premiums and out-of-pocket costs, and protections for the 150 million people in employer-sponsored coverage too, making that more adequate.
What have been the things over the years then since the enaction of the Affordable Care Act, lessons learned, so to speak, and are there ways to improve what's currently being offered?
Certainly. One of the things that we've learned is that people who have incomes above what we call the subsidy cliff, the premium tax credits to lower premiums for people in the marketplaces only apply to people who have income up to 4 times the poverty level. And many people were not able to afford the coverage, even if they had incomes, at 400, just over that mark. So one of the things that Congress did last year was to enact enhanced subsidies to make it more affordable for people to buy coverage. People at the lowest income scale actually pay $0 for the premium each month, and there was no cap on that assistance. Anyone could qualify for a premium tax credit to lower their premium.
How long will these subsidies stay in place?
Just until the end of this year, actually. And that's one of the things that Congress is debating now. The Build Back Better Act would extend those subsidies. It would also extend the targeted help that was provided to people who get unemployment insurance with the COVID, prompted layoffs, and would also fill in coverage in the 12 states that have not expanded Medicaid to cover all adults with low income.
If there's a scenario then where Congress can come up with extending those subsidies, what could happen?
Well, certainly, I mean, it's estimated that in those 12 states where there is no Medicaid coverage for people with the lowest incomes, that could be up to 4 million people could gain coverage. We would expect to see more people enroll in the marketplace. And I think it also, what we've learned is when you give people the freedom to buy coverage on their own, regardless of a pre-existing condition, they have, many more people could become self-employed and change jobs. They were no longer required to think of their job as the place where they had to get their health insurance for their pre-existing condition. And I'm talking about things like diabetes, heart failure, severe obesity, things that a lot of people have. They were tied to their job because of the coverage they had. And under the Affordable Care Act, no one can be turned down, and you may qualify for assistance with your premiums.
As far as the subsidies themselves, is there a way to calculate how many of people who are currently on the ACA depend on those subsidies?
Most of the enrollees before the subsidy enhancements were people under 200% of poverty, the 2 times the poverty level. But since the enhanced subsidies, there were many more people enrolling at the higher income levels.
If you wouldn't mind, then the administration, or at least this current administration, President Biden, talking about this glitch, so to speak, as far as a need of being fixed. Can you explain what that is?
Yeah, I guess there's 4 real areas where the ACA has not filled in, and one of them is coverage for immigrants who are not undocumented immigrants who are not eligible for coverage in the marketplaces or under most Medicaid programs, individuals who are stuck with unaffordable employer coverage, and that was the announcement yesterday. I'll come back to that a little bit. Those who were with income above that cap I told you about for the subsidy enhancement. People in states that didn't expand Medicaid. And then there's just some people we know are already eligible but unenrolled. The announcement yesterday will fix what I call the family glitch. It's individuals who have an offer of employer coverage. It may be affordable by the ACA test for the employee to enroll in the plan on their own, but to add a spouse or children would be unaffordable for the family, but the test only took into account how much it costs for the individual. So those families could not get premium tax credits to buy coverage on their own in the marketplace. So their choice was either to go without coverage or to pay a lot to maintain coverage with their employer plan, their spouse's employer plan. And if that glitch were to be put into place for the families under the ACA, that would be an improvement. But are there other aspects of insurance or who gets insurance and insured, would that be affected as well? I'm sorry. So the glitch is the problem. Just to come back to that, the glitch is the thing that keeps the families, the spouse and children, from being able to get to premium tax credits and more affordable coverage, and they're stuck with the employer plan. And so that there would be up to 6 million people who would benefit from this reinterpretation of that test to take into account the cost to the spouse and children and not just to the employee. Our guest with us until 9:30. If you want to ask her questions, we've divided the lines differently. If you receive your insurance from the Affordable Care Act, 202-748-8000. If you get private insurance, 202-748-8001. You can, if you're not insured, 202-748-8002. And also for everyone else, 202-748-8003. You can also use that number if you want to text us and talk with Joanne Volk of Georgetown University, the Center on Health Insurance Reforms. Ms. Volk, we'll play a little bit of what President Obama had to say about these fixes and then talk to you more about this family glitch.
Even today, some patients still pay too much for their prescriptions. Some poor Americans are still falling through the cracks. In some cases, healthcare subsidies aren't where we want them to be, which means that some working families are still having trouble paying for their coverage. Here's the thing, that's not unusual when we make major progress in this country. The original Social Security Act left out entire categories of people, like domestic workers and farm workers. That had to be changed. In the beginning, Medicare didn't provide all the benefits that it does today. That had to be changed. Throughout history, what you see is that it's important to get something started, to plant a flag, to lay a foundation for further progress. The analogy I've used about the ACA before is that in the same way that was true for early forms of Social Security and Medicare, it was a starter home. It secured the principle of universal health care, provided help immediately to families, but it required us to continually build on it and make it better. And President Biden understands that. And that's what he's done since the day he took office.
Literally how everything that we use today started out. All right? Think about cars. All right? Cars used to be really, really fucking dangerous. And they still are pretty fucking dangerous. But we have decided as a whole that cars are useful and we're going to keep up and we're going to keep improving them. We saw the potential that it had to get us away from like livestock as transportation, and like we wanted that. And that's the same for trains, for like for airplanes. It's like imagine where like video games would be today if the Atari was never invented. You know, that little niche group of nerds who were just playing with their code and eventually came up with some really cool hardware. Like, it really wasn't shit for a while. And now we have like Unreal Engine 5, you know? Which is like, it's taken everything we knew about coding and everything we did to apply coding to video games and is now making it accessible for almost people who have no coding experience at all to start making their own video games. And that's like really significant. And that's like where every form of progress starts. It starts with a half-assed idea that keeps getting improved upon until it becomes a pretty moderately assed idea. Yeah. So it's like, if you can't say that things aren't working because things that it never accounted for aren't being considered. Does that make sense? So it's like, let's say I make a health app, okay, but I forget about menstrual cycles because I'm a man. I made it myself. I didn't really consult any other people with very many other backgrounds, like medical backgrounds, so I left out menstruation completely. It does everything else. Tracks heart rate, tracks tracks blood pressure, tracks like your calories even or something, tracks the amount of steps you get in every day, schedules your runs and stuff for you. But it doesn't have anything for menstrual cycles. Doesn't mean it doesn't work. It doesn't mean you scrap the whole thing. You just add to the code. You build more functions. You create a new class of code for you to establish this goal that you're looking for. Repeal and replace doesn't work that way. If we take every single thing that has a problem and we just need to get rid of it and replace it with something that works, you don't know what works. Like, all the things that you say don't work are on the precipice of like unprecedented assistance. You don't know how to make the perfect package to adequate for the unknowns. It's just impossible. The only thing you can do is start progress somewhere and means test your way into more progress.
So, Ms. Volk, using the starter home analogy that the president used, what would be the full blown out home, I guess, of the ACAs we know it right now?
I mean, I think these, what I call enhanced subsidies, are really key, and he talked about that. The original bill was just a function of how much Congress was going to raise, in revenue and pay for the original plan, and you get the subsidies that you get when you set your limit. They didn't approach it by saying what would be a most affordable premium. They said this is how much we have to spend for individuals who are going to get premium tax credits. That's why the American Rescue Plan Act enacted last year. And the Build Back Better that is pending this year would increase those subsidies to lower how much people have to pay out of pocket to get coverage in the marketplace. And as I said, make it available to everyone regardless of income and not just cut it off for those at 4 times the poverty level. The other big piece is that the Build Back Better would come up with a way to provide coverage to those in the 12 states who won't expand Medicaid to cover the lowest income adults, and that would capture up to 4 million people. It's hard to estimate, but the estimates vary between 2 and 4 million. But many more people would get coverage. So I think that is definitely what I would say builds on the Affordable Care Act. And one of the things we learned during COVID is that it is a remarkably resilient safety net. There were many people who lost jobs, lost hours, lost eligibility for their health benefits on the job, and the marketplace was there. They could not be turned away based on their pre-existing condition. They qualified for subsidies to help pay for their premiums, and in many cases, their out-of-pocket costs. And the administration opened up the marketplace to enrollment. Typically, it's limited to a period in the fall when you can sign up for plans. They open it up with what's called a special enrollment period, recognizing that many people were without coverage and really should have had it during a pandemic. And we had historic enrollment, up to 14.5 million people enrolled in the marketplaces now. So I think we saw that it really did serve as a safety net at this great time of upheaval where people were losing their coverage on their job, but desperately needed coverage during a pandemic.
You mentioned the 14.5 million as of 2022 enrolled through the marketplace. That started off at 8 million. What was the estimated amount of people, if you know, expected to be enrolled in the marketplace at this time?
I'm sorry, the expected amount enrolled
and through the marketplace. What was there an estimate as far as how much people or how many people were, estimated to have insurance through the marketplace at this time?
The most recent number is this 14.5 million. It's believed that about 2 million were newly enrolled, had not had coverage before, and were new enrollees. And those that were.
Okay, that's going to be it for me today. I'm kind of getting closer to class time. I could milk it for a little longer, but I'm having a bit of I'm feeling a little under the weather today, so I'm just going to try and get through the day at whatever pace I'm feeling is appropriate. Thanks for, watching if anybody did. Hope to catch you on again. We're going to be here same time tomorrow. Tune in Friday after 10 a.m. Around 10 a.m. Mountain Time, and we will start doing some more relevant topics, I don't know, not necessarily relevant. All this is relevant. We will go over some more, clickbaity topics. And really break down Ukraine. I want to, I'm going to have some questions that I want answered by the end of it. That's the goal.